Uterine fibroids are abnormal overgrowth, or what you might call tumors, that arise from the muscle cells of the walls of the uterus. They are the most common pelvic tumors in women within the reproductive age. Just like any other tumors, uterine fibroids are classified according to their location in the uterus. So they are what we call intramural fibroids, which are located within the walls of the uterus. There are also submucosal fibroids. These are located just below the lining of the uterine cavity. Then the subserosal fibroids are just at the serosal surface of the uterus. And lastly, there are cervical fibroids, which are located in the cervix other than the uterine body. But the thing is, just like we call fibroids tumors, the good news is they are non-cancerous. There are several factors that can predispose women to the development of these fibroids. Genetics being one of them, in that a woman who has her first degree relatives with this disease of fibroids also has higher chances of developing them later in life. It's still believed that a lady who gives birth to very many children has less chances of developing fibroids compared to her counterpart who gives birth to fewer children. In women who start their menses earlier in life, that is below 12 years of age, have increased chances of developing uterine fibroids later on in life. Then also, women who are obese with increased body mass index have higher chances of developing uterine fibroids compared to their counterparts who are not obese. When it comes to dieting, women who like eating a lot of red meat, that is beef and pork, have higher chances of developing uterine fibroids compared to their counterparts who eat more of plant sources. Those are the vegetables, the fruits, and seeds. Still, women who drink a lot of alcohol have higher chances of developing uterine fibroids. However, it's believed that smoking reduces the chances of developing these fibroids. Not all women with fibroids will present with symptoms. However, those few that come with symptoms of fibroids usually present with heavy or prolonged menstrual bleeding. Others will present with reproductive dysfunction, which entails failure to conceive and also increased chances of having recurrent miscarriages. Other women can present with bulk symptoms, in that some fibroids are so big and they end up compressing the urinary bladder and also the ureters, causing urine outflow obstruction, and some tumors still can compress against the intestines, causing constipation. However, some women will come in with symptoms of pain during their menses and also during intercourse. With all these symptoms that a woman can present with, the diagnosis is usually made after making a full physical exam of the woman, especially the pelvis, and doing a pelvic ultrasonography. The treatment of uterine fibroids is usually aimed at reducing the symptoms with which a woman presents with. Firstly, we begin with the medical therapy. This entails the use of drugs, in that we can use combined oral contraceptives, we can use progestin releasing IUDs, we can also use tranexamic acid in women who would wish to only take medications only when symptoms are present, and also we use it in women who are not fit to use contraceptives, like those ones who would like to conceive. This is a point to note. There is no drug that can make fibroids disappear. Instead, all drugs we give only reduce the severity of the symptoms brought in by the fibroids. However, for some women who might not respond to medical therapy or who are not candidates to medical therapy, they can go on to have surgery. With surgery, they can have only the fibroids removed from their uteruses, or in some cases, they can have the entire uterus together with the fibroids also removed. So, let's all stand together and save lives of women with fibroids and give them a better quality of life.